Hello everybody and welcome back to this session on herbal product technology and regulatory science. Today we will look into the Indian traditional system of medicines. Greetings of the day all of you. In the earlier sessions we have seen what herbs are, where we can use these herbs. These herbs are available around us, we use them every day, they are available on our kitchen platforms, we are using them as fruits, vegetables, and we have seen examples of few of these herbs where they can be used as a primary medicine for any kind of disease, for prevention and for cure. Today I am going to introduce to you the different types of traditional systems of medicines which are practiced in India. So, these system of medicines are there in Indian culture since 1000 years and they are now integrated into every healthcare. So, introducing to you the first traditional system of medicine which is called the Ayurveda. This is very much our own Indian traditional system of medicine. This was found by Lord Dhanvantari. The second system of medicine which is practiced in India was first initiated by a group of Tamil scholars and this is known as Siddha. Siddha the name has originated from Siddhi in Tamil which means perfection. The third one which I am going to introduce today is Yunani system of medicine. Though not originated in India, this is a Greek system of medicine, but it has been recognized by Ayush and has now been integrated into the Ayush practices. Last but not the least is the homeopathic system of medicine. The founder or father of homeopathic system of medicine is Dr. Samuel. We will now look into the basics of these system of medicines. Apart from this, there is the Tibetan system of medicine which is practiced in Himalaya. Yoga which is integrated with Ayurveda is also considered a part or way of life. Coming to Ayurveda which is integrated into our Indian healthcare or Indian medical heritage, this system of medicine is known to represent the Indian herbal medicines. Ayur means life and Veda means science. So, Ayurveda is a Sanskrit word, it is derived from a Sanskrit word and where Ayush means life or longevity and Veda is the knowledge or science of how do we preserve this life or how do we improve the longevity. Thus, Ayurveda literally means the science of life and longevity. This system of medicine focuses not only on curing diseases, but also on prevention, wellness and harmony with nature. So, what we see here is a picture of Lord Dhanvantari. This Lord was known to emerge during the Samudra Manthan. He emerged with a pot of elixir in his hand and this liquid was considered to be the divine liquid of healing and hence Lord Dhanvantari is considered to be god of healing. Any Ayurvedic hospital, any Ayurvedic college if you go, you will see a small temple or a small statue or photo of Lord Dhanvantari, and praying to Lord Dhanvantari is known to cause or evoke his blessings for healing using different kind of rasayanas or the Ayurvedic medicines. Let me introduce you to the basic principles of Ayurveda. The first principle which Ayurveda uses or believes is the Pancha Mahabhuta Siddhantas. Pancha means 5, Maha means great, and Bhutas means elements. Pancha Mahabhuta is 5 great elements, and Siddhantas means principle. So, the basis of Ayurveda lies on these 5 great principles or 5 great elements. The first one is Prithvi, the second one is Aap or water, the third one is Tejas or fire, the fourth one is Vayu or air, and the fifth one is Akasa, which is ether and space. So, Ayurveda believes that this universe, which they call as macrosum, in this whole universe, our human body is microsum. So, this human body is made from the universe, and this human body has elements from the universe. So, we are part of the universe. When we are born with the elements of the universe. After life, these elements then become a part of the main universe. So, we are coming from the universe and becoming a part of the universe later after life. The second basic principle on which this Ayurveda theory or Ayurveda diagnosis is based on, this forms the most important part of Ayurvedic diagnosis or the use of rasayanas. This is the Tridosha theory. Life and health depends on balance of these 3 Tridoshas, Vata, Pitta and Kapha. These are very, very important while a disease is diagnosed or while a body is assessed for the health condition. So, they believe that Vata is made up of air and ether, which governs movement, governs circulation and all the nerve impulses in the body. The second one is Pitta, which is made up of fire and water. This governs digestion, metabolism and transformation. The third one is Kapha, which is made up of earth and water, and this governs stability, structure and lubrications. So, we have to remember that Ayurvedic theory is based on these 3 doshas. As long as these 3 doshas are in harmony in the body, the individual is considered to be healthy. The minute there is an imbalance in these 3 doshas and one of the dosha becomes predominant, then this imbalance is called as a disease. And there are a group of herbs which are called as rasayanas in Ayurveda, which are used to treat this imbalance. For example, there are a group of drugs, group of rasayanas used to treat Vata, a group of drugs used to treat Pitta, and another set of drugs which are used to treat Kapha. So, the treatment is holistic, where it tries to balance all these 3 doshas and thus maintain an equilibrium. This balance brings an harmony of the body with the mind and the soul, and hence it is considered to be an holistic healing. Hence, in Ayurveda principles, health is equal to equilibrium of all the doshas. A disease is called an imbalance of doshas. So, whenever there is an onset of any disease, one of the dosha is predominant, and this we call as prakriti of a person. So, wherever there, if a person shows predominance of vata, he or she is susceptible to joint pain. If a pitta is predominant in a individual, which means there is some kind of digestion problems, either an increased secretion of acids or indigestion, or there is a metabolism disorder in digestion. Wherever a kapha predominates, this leads to respiratory problems. Hence, Ayurveda believes that vata, which is a combination of ether and air, pitta, which is fire and water, and kapha, which is water and earth. When all these elements are in harmony, the person enjoys a perfect prakriti. The third basic principle of Ayurveda is it believes that the human body is made up of sapta dhatus, 7 tissues, which we also have heard about this in the modern medicine. The first one is rasa, which in modern terminology we understand it as plasma. The second is rakta or blood. The third is mamsa or muscle, shukra, which is the reproductive system, which has healthy sperms and ovum, maja is bone marrow, asti is bone, and in the center we see medha or fat. So, all these sapta dhatus are responsible for maintaining the tridoshas in balance. So, as long as these 7 elements are in their perfect condition, the tridoshas are in harmony, and when the tridoshas are in harmony, we have a perfect prakriti of a person. The fourth one is mala or waste products. Mal, mala, this is again derived from a Sanskrit word, and the normal elimination of waste shows that the health of an individual is good or perfect. So, early morning elimination of fecal matter, elimination of urine, the flow of urine, the flow rate of urine, the volume of urine. If the urine is blocked, which means the waste is not getting eliminated, there is some imbalance in the body. And the third waste which the body eliminates is in the form of sweat, which is called sweda. So, the fecal matter, urine and sweat, the elimination of this waste is directly proportional to ahara or diet of a person. What diet is consumed by the person, at what time it is consumed by the person is very, very important in case of Ayurveda. So, when we go into the details of these principles and try to understand the metabolism, Ayurveda also tells us which kind of food is to be consumed in which season and at what time of the day. For example, we must have heard our grandparents or Vaidyas telling us not to consume curds or buttermilk after a particular part of the day. So, all this is directly proportional to the body's metabolism and the elimination in form of fecal matter, urine and sweat. We've also heard the analysis of waste products in our modern medicine, where they try to analyze what fecal matter, urine or sweat contains. We can also analyze the functioning of different organs in the body by analyzing the waste products. The fifth one is Agni, the fire inside the human body. This is responsible for digestion, absorption and assimilation. So, in short, Agni is responsible for the energy which we have in the body. So, the metabolic power is directly dependent on the digestive power of the body. The digestion, absorption, if it is proper, which means that there is a balanced Agni and health, the health of the person is good, which also will tell us that the Tridoshas are balanced. Imbalanced Agni leads to a disease. The last one are the body channels, which are called as Srotas. These channels through which the nutrients, waste and energy is circulated in the body, and the body energy also falls correct or is determined by the correct functioning of these body channels. The blockage or dysfunction of this leads to a disease. The seventh basic principle of Ayurveda is every individual has a unique constitution. Like I mentioned before, that is called the prakriti of a person. Whether what is the harmony between Vata, Pitta and Kapha in a particular individual. And there are different methods of finding out the balance between these and also finding out which kind of dosha is predominant in a person. And this is what is learnt or taught or understood by an Ayurvedic practitioner whom we refer to as Vaidya. The treatment and lifestyle are personalized according to one's prakriti. So, yoga, which I mentioned, is also a way of life. So, along with rasayanas, yoga, a diet and a lifestyle is personalized for a person. For example, if a person eats too much of spicy things, has excessive traveling, has excessive stress, then there should be a change in the lifestyle, and there are rasayanas which are prescribed for an imbalance of vata. In such cases, it is said it is most probably the vata which predominates in a person. The eighth principle is swasthya. Swasthya or swasthya, which is definition of health in Ayurveda. Charak Samhita and Shushruta Samhita. Charak and Shushruta are two Ayurvedic practitioners who define health as balance in all the doshas, proper functioning of Agni, which we saw in the earlier slide, balanced dhatus, the 7 sapta dhatus which we discussed, and the malas, which is the waste. A pleasant state of mind, senses and soul is very, very essential for all the drugs to act and for all the doshas to balance. Thus, Ayurveda is based on balance of Pancha Mahabhutas, the 5 elements, the Tridoshas, the 7 dhatus, the malas or the waste products, and the Agni, which is the fire inside, which is responsible for digestion and assimilation of whatever diet is consumed. This aims for a perfect harmony of body, mind and spirit. So, when we look at Ayurvedic principles, an healthy individual is not an individual only free from a disease. An individual is considered healthy when there is a perfect harmony in the body, all the organs of the body, the sapta dhatus of the body, and also there is a harmony of mind and spirit. Let us now look into the second traditional medicine which is found in India. This is Siddha. This was first found by a group of Tamil scholars, and Siddha has originated from a Tamil word Siddhi, which means perfection. This also is based on similar principles like Ayurveda, where we saw in Ayurveda there is Vata, Pitta and Kapha. Siddha also believes on same principles. They believe in an harmony in Vatam, Pittam and Kapham. And they also believe that the universe and human body are made up of 5 fundamental elements. Like I said before, universe is macrocosm and the human body is made up by the elements from this universe, and it is the microcosm. The 5 fundamental elements in case of Siddha, the first is Man or earth, the second is Neer or water, the third is fire or Thi, the fourth is Katru, which is movement and energy, and the fifth one is Agayam, which is ether and space. This is the expansiveness. Like Ayurveda, Siddha also believes in clean excretory products. Malam, it was called Mala in Ayurveda, here it is called Malam. The normal elimination of waste at a proper time is very essential or is considered as good health. So, the fecal matter is called Puram, the urine is called Mutiram, and the sweat, which is perspiration. So, the 5 elements are shown below. This believes in 3 humors like the 3 doshas, and this is Vatam, Pittam and Kapha. Vata is made up of air and ether, it controls movement and it controls nervous system. Pitta is made up of fire and water, controls digestion and metabolism. Kapha, which is made up of earth and water, controls the stability as is responsible for giving the strength to the muscles and body. So, health is considered to be a balance or harmony of these 3 muktarams, which is Vatam, Pittam and Kapham, and a body is known to be in a disease state if there is an imbalance between these 3 doshas. Similar to the Ayurveda's Sapta Dhatus, there are 7 dhatus mentioned in Siddha literature. These are called Udal Tattukal. This is derived from a Tamil word. Udal means physical or the body. 7 physical constituents of the body. Saram is plasma, Chinir is blood, Un is muscles, Kozuppu is fat, Enbu means bone health, Mulai is bone marrow and nerves, and Sukilam or Suronitham is the reproductive system. So, if all the elements are functioning properly, this leads to a balance in the 3 doshas. Uir Thattukal, Uir means life. So, vital life forces. Siddha describes 10 vital life forces that maintain physiological activities. The 5 pranan, which is inward vital airs, and the 5 upranan, which is the outward vital airs. So, inhalation and exhalation is very, very important. So, we have heard of pranayams, these are very, very important. Siddha, like Ayurveda, believes in pulse reading. The kind of pulse is evaluated, the left hand pulse for women and right hand pulse for men. So, the kind of pulse, this is named after animals or reptiles. So, the common ones known in case of Siddha are Manduka pulse, which represents frog. So, if the pulse is high, it is Manduka. If the pulse is wavy, it is snake, serp like pulse or a swan like pulse. Lifestyle is very, very important in case of Ayurveda and Siddha. What diet you take, like I mentioned earlier, spicy diet, excessive gap between meals, fasting between meals, this leads to an imbalance in the doshas. Seasonal adaptations, as the season changes, there should be a change in the diet. Spiritual practice to keep an harmony between the mind, soul and the body, and lifestyle. No exercise, excessive eating of sweet, excessive eating of fried, all this leads to an imbalance. So, the 3 humors are mentioned here also, like the Ayurvedic system of medicine, 3 humors, 10 vital forces, 7 body constituents, which leads to harmony. Continuing with the Yunani system of medicine, this is also a traditional system of medicine practiced by the Greek, and this was brought by the Arabs, but this is recognized by Ayush and integrated into their system of medicine. The basic principles of Yunani system of medicine is Arkan, which believes that there are 4 elements, the body is made up of 4 elements: earth, water, fire and air. Mizaj, the temperament of a person, which is unique to each person. Each one of us is unique, and we've often heard this name Mizaj. Kaise Mizaj hai aapka? So, this is the temperament of the person today or that minute. Akhlat is 4 humors: blood, phlegm, yellow bile and black bile. So, this is the main diagnosis for Unani system of medicine. Any diseased body shows metabolic products in blood, phlegm, yellow or black bile. Arva, which is the vital spirit. So, this tells us how the cardiovascular system of a person is. This is the life force directly from the heart. Kuva are the facilities which tells us the mental condition of a person. So, the psychic, vital, natural powers which are there in a person. Afal is physiological functions of the person, and Aspab is Sitta, Zaruriya are 6 essential lifestyle factors which they consider is the good air which you are breathing, the food and drink which is part of your diet, how much amount of activity and rest you have. Are you exercising enough? Are you having good rest, good sleep of 6 to 8 hours? If this is proper, then the mental state of the person is good. Sleep, which I just mentioned, and elimination, the metabolites which are being eliminated, the waste which is being eliminated out from the body. So, if there is an equilibrium between the element, humors, vital spirit, that is caused good health of a person. Coming to homeopathy, this also did not originate, though it did not originate in India, but very much practiced in India and also recognized by Ayush, and this is named or developed by Dr. Samuel Hahnemann in 1796. This is little different from the other traditional systems of medicines which I just mentioned, and the basic principle of homeopathy is the system is developed from a line which says like cures like. So, here there is a concept of proving and prover, and homeopathic medicines or herbs were discovered using the principle of proving. Now, for example, if you have observed, while cutting onions, there is a lot of water from our eyes and nose. So, when a herb or a plant causes symptoms like this, the herb is used to treat symptoms which are seen similarly. For example, if onion is causing a runny nose or watery eyes, you can use onion to treat a runny nose. So, using this principles, the natural substances were termed as medicine. This also focuses on holistic treatment of the mind, body and emotions together. And there is a very strong belief in homeopathy that no one size fits all. So, if you have gone to an homeopathic practitioner, an entire life history is asked. What is the mental state, what the person has been eating, what is the kind of lifestyle he has, what is his diet, what he eats, when he eats, what is the kind of stress the person is going on. So, all this, after knowing all this history, the drugs are prescribed. So, the basic principle here is a law of similars which I mentioned, a substance which causes symptoms in a healthy person can cure similar symptoms in sick people. So, if by eating a herb, a plant or a food, if you get headache, that herb can be used to cure headache. If by eating a herb your blood pressure increases, that herb can be used to treat hypertension. This is the law of similar. It believes that the law of minimum dose, because it believes in the theory of proving and prover, a drug which causes a symptom is used to treat a symptom. So, they believe that a small amount of this substance is used to elicit a response, to potentiate or elicit a response. So, they start the treatment with a very, very dilute amount of medicine. Usually, only one remedy is given at a time. So, they just see that by potentiating or by mimicking that in the body inside, whether the body health can be improved. Thus, no same treatment is given to two individuals. The concept of health and disease here in this system of medicine also remains the same. This is, they believe in a perfect balance of all the vital forces, and a disease sets in when there is a disturbance in this vital forces. The treatment is considered to be safe, gentle and non-toxic, and cure is believed to restore the balance by stimulating the body's self-healing power. These are some of the references used, and I thank you for listening to these Indian traditional system of medicines. So, to summarize, these were a few Indian traditional system of medicines which actually preserve the rich Indian medical heritage. Each system of medicine not only believes in treating only the symptoms, but it also believes in a holistic approach where the mind, body and soul are at equilibrium. So, they believe in a cure or prevention of the disease by bringing in harmony of all the doshas in the body, where not only the disease symptoms are cured, but the disease is completely eradicated from the body. Thank you and see you in the next session.